We want the office managers to be excited about this, fall into that functional level. They don't have any previous experience, any previous education. So on the right side, we see the three components, the three levels of a functional office manager. And at our lowest level, level 1 of 10, we call this process. This is where the office manager comes to work. Even if they're successful, they want to keep improving. And the best way to not decline is to keep growing. So at level 1, we have this process office manager. They're probably not going to change much. They're going to do the same things most days that they've always done. They're not going to contribute to the growth and development of the office. They're focused heavily on making sure we get through today and get the basics done, the basics they know to do. Now, the next level up, and this is what we're teaching very early in our program, so I encourage everybody to jump on this, are the numbers. The next level up is when the office manager can really assess the practice KPIs, key performance indicators. They know what production should be. They know what the daily goal is. They're studying the average production per patient, the average production per referral source, the average production per procedure, the average production per provider. Many office managers that we're working with right now had no idea how productive or unproductive some of their doctors were. And this is important because then they can decide who wants help, how can they help them, how do we change the schedule. So knowing the numbers is important. And just for our listeners, to get very granular and practical for just a moment, I would focus first for this office manager on the production numbers. Total production, production per day, production per hour, production per provider, production per new patient, and production as a ratio of overhead. And watch overhead carefully, everybody. It is rising. We're seeing more practices than ever before where production's going up and profits going down. And the only reason for that is overhead's growing faster in some cases than profit. And then the third one is huge, but I'm going to cover it quickly. Putting systems in place. What should the new scheduling system be? You've got to update scheduling regularly. What should the case presentation system be? Do we have an implant treatment coordinator or do we not have an implant treatment coordinator? And either way, we still have to have a great sales process that's positive and motivating and influential for the patient. So systems are how businesses run.